elevation of blood pressure, that is the systolic blood pressure of above 140 and the diastolic of 90 millimeters of mercury. So remember what we said is that each time you are going to make a definition of any condition, you should always remember that which system are you talking about. So in this case, hypertension, it is a cardiovascular disorder in which there is the sustained elevation of the blood pressure, that is systolic of over 140 and the diastolic that of 90 millimeters of mercury. That way, you'll be able to acquire all your full marks because you have met the requirements of a full definition for your examination. So, in hypertension, the main problem is that there is an elevation of the blood pressure. This has to be taken at 3 different times, or should we say in 3 different intervals in 24 hours. Are we together? This is when the patient is at rest. The patient needs to be at rest. You have to take the blood pressure at 3 different intervals. And if this blood pressure is still elevated, then it qualifies to be called hypertension. Okay. So if we are to classify the hypertension, it can be classified into 2. That is the primary. The primary hypertension is also called essential hypertension. If there is primary, then you definitely know that there is supposed to be secondary hypertension. So, in essential hypertension, it is far more common condition and accounts for 90 to 95% of all cases of hypertension. So the primary hypertension is therefore the commonest, and the cause normally is idiopathic. Idiopathic, we mean that its cause is not known. And it has the tendency to run in families. This is one of the characteristics of this kind of hypertension, which is essential. It tends to run in families. And the primary hypertension can further be subdivided in 2. 1, benign hypertension, which can be present for a long time without causing serious problems to the individual. And this is called benign. Then, of course, the second type is malignant hypertension, which is of sudden onset and produces severe symptoms, making several to a few months up to 2 years, if not properly managed. The person can just survive up to a very short period of time if this one is not properly managed. So we said that primary hypertension is divided into two. One, we said it can be benign hypertension or it can be malignant hypertension. Now, let's briefly look at secondary hypertension. In secondary hypertension, it accounts for up to 5 to 10% of people with hypertension. So this means that the hypertension in these individuals is secondary to a cause. There is an underlying cause. For example, specific disorders of particular organs or blood vessels, such as maybe the problem with the kidneys, the problem with the adrenal glands, or aortic artery. These conditions, when present, can cause hypertension, which is secondary hypertension. So let's briefly look at some of the causes of secondary hypertension. We've already said that it can be caused by adrenal gland tumors. Okay, like for example, in adrenal gland tumors, we have got a condition known as pheochromocytoma, which is the tumor which produces some adrenal gland hormones. I'll explain that in the short while when we start looking at the pathophysiology. So anxiety and stress, these are common cause of hypertension. When somebody is anxious or when they are stressed, there is the release of these stress hormones, and we know how these stress hormones work on the arterial walls. They have got an effect on the arterial walls, meaning there is this vasoconstriction. I'll come to explain that further when we begin to look at the pathophysiology, just in a short while. The other cause can be arteriosclerosis. In arteriosclerosis, we all know that there is usually hardening of the blood vessels. And when there is hardening of the blood vessels, you find that this creates or this increases the resistance, raising the intravascular pressure, and this sustains the blood pressure high. Coarctation of the aorta. In coarctation of the aorta, we know that these are the defects which happens onto the walls of the aorta. There is thinning in the lumen in coarctation, leading to increased intravascular pressure. Endocrine disorders also can have been implicated in the causation of hypertension, such as Cushing's syndrome. In some cases, also this diabetes can also cause some elevation in blood pressure. Okay, so we continue with the causes. We can also have kidney disorders such as glomerulonephritis, kidney failure, renal artery stenosis, and renal vascular obstruction or narrowing. All these, they lead to the sustaining high of the blood pressure, which are under the cause known as secondary hypertension. Okay? Obesity also. You know that in obesity, there is an increase in the deposition of fats, which leads to an increase in the blood pressure of that individual. We also can look at pregnancy. We know that in pregnancy, this could also be called gestational hypertension, where you find that some people tend to have an elevation in blood pressure because of the pregnancy. Or sometimes they may even call it pregnancy-induced hypertension. Yeah. Then we have got arterial stenosis, which we have already talked about in renal stenosis as condition. Yeah. So, in the kidney diseases, when we talk about the kidney diseases, in the kidney disorders, there is renal ischemia, which in turn leads to activation of renin-angiotensin system. So in the renin-angiotensin system, this is a very, very, very important cause of hypertension. I'll explain that shortly. Renin, we know that it leads to the conversion of the present angiotensinogen in the bloodstream. In your multiple choice questions, a question can be asked, where is angiotensinogen produced? So this is one of those hormones, one of those proteins, the plasma proteins, which are produced from the liver, and it's always present in the bloodstream. So when renin is produced, it mixes with the angiotensinogen. This angiotensinogen then is converted to angiotensin 1. Is that clear? I go back a bit. You can, of course, don't worry, we can still go back. We are saying that in a situation where there is a renal condition, there will be a production of renin. And renin is going to convert the plasma protein angiotensinogen, which is present in blood, into angiotensinogen in angiotensin 1. Okay? Then this angiotensin 1 is going to be converted further in the pneumocyte cells in the lungs into angiotensinogen in angiotensin 2. We all know that angiotensin 2 has got some properties which brings about constriction of the blood pressure, or of the blood vessels, sorry. So once there is a constriction of the blood vessels, you are going to find that there will be an increase in the peripheral resistance of the blood vessels. And when there is an increase in the peripheral resistance of the blood vessels, you find that there also going to be an increase in the blood pressure. And once the blood vessels also dilate, you'll find that there is also going to be a reduction in the peripheral resistance. So meaning, just here, what I have said, you need to mark this, because this is where even some of the treatment of hypertension is going to be derived from. When we talk about the treatment of hypertension, you find that one of the drugs that is given is vasodilator. Why are we dilating the vessels? Because these blood vessels are constricting, and when they are constricting, meaning there is an increase in intra-abdominal pressure, resulting in an increase in the blood pressure, which is the condition we are talking about now, hypertension. Okay? So, the other reason which we are going to look at is that because of the production of this angiotensin 2, it leads to the production of aldosterone, which is the main cause of the retention of sodium. And when sodium is retained, we all know that it also attracts water. And this water, once it is retained, there will be an increase in the intravascular volume. An increase in the intravascular volume is going to lead to an increase in the hydrostatic pressure, resulting in an increase in the blood pressure. Therefore, this also mark, because this is where you find that some patients who's seen to have an increase in the intravascular volume, they are going to be given some drugs to reduce this volume. And guess what? Which one of these drugs? It is what? Guess? Starts with L, A, X, Lasix. Very good. That's right. So this one is a diuretic, which will allow excess removal of extra fluid, resulting in an equilibrium of the intravascular volume, resulting in a reduction of the blood pressure. Okay? So once we have got an increase in the circulatory volume, we are saying that we are also going to have an increase in the blood pressure. Therefore, from what we have discussed, we have seen that management of blood pressure is very, very interesting. You are targeting, one, a reduction in peripheral resistance. Two, you are targeting a reduction in fluid volume. Very good. So, any question from up to this stage? Okay. We'll end here. We'll meet in the next session where we are going to look at the nursing management of the patient who has got hypertension. Thank you for watching. Bye-bye. So somebody sees it's a live.